Heavy thighs is a very common concern in our population, and lot of women and men find themselves stuck with resistant fat which does not respond to diet or exercise. I am Dr. Shilpi Bhadani. I am a plastic and aesthetic surgeon at SB Aesthetics, Gurgaon, India. I do thigh liposuction or thigh contouring very commonly in my practice. And the most common concern is that people say that, doctor, this fat which is there in the outer thighs or the inner thighs, it just doesn't budge. So what do we do about it? Thigh liposuction as such is a very rewarding procedure for the patient as well as for the surgeon. Now let me take you through a few cases where we've achieved significant change in the thigh contour with thigh liposuction and sometimes with an added thigh lift. So I take you to the first case where this lady was concerned about the fat deposit in her lower half of the body. The upper half is relatively narrow, but the lower half of the body you can see is quite bulky. And in the first procedure that I did for her, I decided to target the outer thighs, inner thighs, the lower part of the thighs, as well as a little bit of the lower area of the flanks. And you can see what a huge change we've been able to achieve just with one procedure. The recovery process of thigh liposuction can, for some people, be a little tedious initially, but if taken care, it rewards you very well. Now, when we look at the change that we can achieve, so sometimes, people may come up with only this outer thigh bulge, and we can target this area alone in a lot of cases. Some women will also approach with the inner thigh bulge, and these can definitely be sorted out individually, even if we are not dealing with the entire thigh in one go. For this lady, of course, we've done a procedure for the abdomen as well, and you can see that an abdominoplasty has been done. And in this case, we've been overall been able to change the entire silhouette, entire contour very well with two surgeries, which is one is the thigh liposuction and the second is the abdominoplasty procedure. Now let's take a look at the second case. Now, a lot of time, even slightly leaner women will approach me for the thigh contouring, and there can be runners when they run, they feel that the outer thigh fat is moving separately or the inner thigh fat is moving separately, and it is not responding even to a lot of exercise and diet. And they say that this fat has been resistant for years altogether. Now you see in this picture, the thigh fat is as such not huge, but still she desires leaner thighs and better contour. And that is what we've been able to achieve with the thigh liposuction procedure. If you see the incisions, they are really small ones, and these heal beautifully with time and they hardly leave any scars. And you see the entire contour of the thigh, even the width of the thigh, if you see, has been changed to quite a leaner looking profile. When we consider more huge thighs, so this particular lady was concerned about the large fat deposit that was present in mainly the inner thighs as well as the front of the thighs. Now, if we see such huge cases, then what happens? We need to tackle the excess fat, and after that, we also need to tackle the skin sagginess that may come after the procedure. So, you see, after one procedure, the thigh fat has been reduced drastically, but it has also led to slight looseness of the skin around here. So this is, you can see that this procedure, after the procedure, there's a little bit of sagginess that is there. Now a lot of women may be okay with this, but when we want tighter looking thighs, then in such huge cases, we may have to do a thigh lift, which has to be a follow-up procedure after the thigh liposuction. And this is what we've done, and the excess skin has been trimmed off. So we've pulled the thigh like that, and that leaves a scar, which initially it may feel that the scar is quite visible and quite long, but believe me, it settles down really well. And you see from the picture here, where we see that the thigh is huge, the skin is lax, the fat deposits are so much, from there to here, the journey is quite rewarding. So of course, we've been able to achieve slimmer thighs and also lifted or tighter thighs. So in women or men where we find that the skin may not shrink that well, we may have to do a thigh lift procedure. But again, telling you the fact that a lot of women will be okay with even this. From here to here is quite a change for them, and they would not want to resort to a thigh lift, which is okay, and that is a personal choice. But a lot of times the thigh lift scar may not look like this, and we may be able to give you a good result even with a shorter scar, which can be from here to here. So obviously, again, when we are talking about thigh lift procedures, massive weight loss patients are a very important category post bariatric surgery. So they lose the weight, but the sag remains, and in that a thigh lift procedure is really a very good procedure to do. So when we talk about shorter scars, the scar can be a shorter one, and the scar here is nearly not visible, and usually it is not visible in clothing. We place them very well, and the scars really heal very well if taken care of properly. So obviously, all in all, if you are worried about the heaviness of your lower body, a thigh liposuction, even if for the outer thighs and inner thighs in an isolated way, can lead to a large difference in the largeness of your lower body or the heaviness of your lower body. If you have questions regarding thigh liposuction or body contouring in general, do drop them in the comment box below, and I shall be very happy to answer them. Thank you for following our channel SB Aesthetics. We do have another channel by the name of SB Trichology, where we post hair transplant related information. Thank you for watching.